Hey everybody, it's Lori. I just thought that I would talk a little bit about my patch that I wear for pain. I am on a muscle relaxer from the pain clinic, which is very mellow. It does nothing barely. And then Neurotin, which a lot of people are on that, and it always made me feel loopy, but it helps a little bit. It does help a little bit. So I'm on a Butrans patch, and I literally just put my new one. I was at my pain management appointment a couple of weeks ago, and I was afraid to ask the doctor to up my dose. I think I talked about this in my last video about not being afraid to ask, and I was scared. But I had waited 2 hours. He was so busy, and we talked about like injections, would I get more, and he just said he didn't think it would benefit me in any way, you know, because I had everything done years ago, and the trigger joint injections didn't do nothing. Anyways, so now I literally just put this on. I'm on day 1. I'm going to try to pronounce the active ingredient, buprenorphine, okay, but I call it the Butrans patch, which it is, but that's the main ingredient. Now let me just say real quick, a lot of people get this drug. I mean, it is a drug. It's for people that either have pain around the clock, or people that have been on pain pills for so long that they don't do anything, because that's what happened to me. I got immune to it. It's not that I was abusing them, my body was on them for so long, and it got to a point where my pain wasn't being managed. And so, the Butrans patch does start out at 5 micrograms, and then it goes to 7.5, 10, 15, and 20. Well, I was on the 15 for years. I mean, at least 6 or 7 years. And I never asked for an increase. I knew there was only one more increase, and I was saving it for a rainy day. Well, you know, my pain's been getting bad and not managed, you know, as much as I would like to, because I can handle pain, but not to the point where like I'm hurting no matter what I do. So I just said, you know, would you be willing to consider putting me to the dose to 20 micrograms? And I said, I know it's the last dose, but, you know, and he said, yeah, Lori, I would, you know, because you have never asked for an increase, and I know that you're responsible, etc. The only thing he was concerned with was, I don't know why he said 18 months. You know, my fear, Lori, is that in 18 months, you're sustained and nothing it's not helping anymore, you know what I mean? And then what do we do? Well, when he said 18 months, I don't know if he just threw that number out there, because I was on the 15 for at least 7-8 years, and then now he's putting me on the 20, right? That's the maximum. So I'm hoping I get more than 18 months off of that, and then, you know, after that we'll figure out you know, the next step. Sorry, I look at my notes a lot. I have dry mouth, so I'm either chewing gum, putting chapstick on, or drinking water. So I was jotting down some stuff. I have been with the pain clinic for about 12 years. I've been in pain since 2010, but I never sought out any kind of pain management. They would God, would they load me up at the ER with whatever, you know, but that was short term, and it made me sick because I wasn't used to taking any kind of drug. So it's crazy that I went from taking, like, you know, a pain pill every 6 hours to being on this patch, because this patch is meant for people that, I don't want to say opioid dependence, which it also is, and I'm going to talk about that in a second, because people get the Butrans patch mixed up with, I think it's Suboxone. I think that's the name of a drug that people, I think they have to like go somewhere and then drink it. It's for people that are addicts and trying to, you know, go back to a normal life. But as I was reading some of the, just real quick on Google, you know, it was saying that people drug addicts are also on this Butrans patch, which really doesn't make sense because it's considered an opioid, and if they're reliant on pain medicine, maybe it's just a step down. Like maybe they're on high doses of morphine. It could be anything, and then the next step for that patient was to try this patch. So maybe that's why, but I didn't look that far into it. So I've been with pain management for about 12 years. Been with this doctor for about 8 years. Before him, I had a really nice Asian doctor. Not that it matters he's Asian, but it was just, he was so good to me. We tried every test. You know, he never forced me to do anything. He listened to me. He was sympathetic for me. And I'm not putting my current doctor down at all because, you know, we get along great, you know. I used to cry all the time in the beginning of seeing him because he didn't know me, so I just looked like somebody that's crying and wants pain medicine. And so once people see my story and they look on the computer and see, oh my goodness, this girl has been through it. She had every test, procedure, surgery done. And so, yeah, so before him, I had a nice Asian guy, but he switched locations. And then before that, I was seeing a woman that came and visited me in the hospital in the beginning of 2012. She was in pain medicine, and then, you know, she gave me a card to make an appointment. So I seen her for a little bit, but she didn't think she could help me either, so she referred me to the Asian man. And I had him for a couple years, and he was great. And now I have my new doctor, and it's been steady for years. So I'm really curious how I'm going to feel in the morning. In the mornings, anybody with chronic pain or illness, you know, in the mornings is the worst. You want to get up, but your body's saying no. So I think I will know in the morning if this new patch is helping even a tidbit, or it could take a few days. I don't know. I'll know because my pain is pretty bad, especially in the morning, and I'll know if there's just even a little bit of relief, even if it's easier, a tiny bit to get out of bed. What else do I want to talk about? I just want to talk about that, and then I already showed you guys. And this sensor is for my diabetes. I can use my phone to check my blood sugar. So much better, guys. So much better to do that than, sorry about the lighting. It's so much easier to check my blood sugar with my phone anytime I want, as opposed to pricking my finger. I hate doing that. Yeah, so that's what's been going on. So I go to see my next doctor that I go see. I had pain clinic. The next doctor is my psychiatrist, so I'll go over some things with her. You know, it's a short visit. You know, I've had a lot of mental health things happening in the last few weeks, so I tend to keep things to myself, even though it's a psychiatrist and that's the person you're supposed to trust. And I love her to death. She's a little petite woman and has an accent, and you can just tell when you look in her eyes that she knows you're going through a lot, and she's sympathetic. So I'm going to have to talk to her about, you know, the way I've been feeling. I've been having some changes in my behavior and my moods and everything. So that's in 2 days, guys. So I see pain management. I'm going to see my psychiatrist, and then at the end of December, 3 days after Christmas, I'm going to have my endo visit, which is for my diabetes, which is being very well managed. And not just because that I'm trying to eat right or not eating right, or I don't have an appetite because of the Mounjaro. Just everything together. It all came together. It's just sad that I had to end up in the hospital last year before they even tried to give me something stronger for my diabetes. So yeah, my numbers are good, and she's gonna love that. I think I have to get blood work, and then I see my PCP next year in January, just for an annual, you know, visit and check up, and, you know, just tell them everything that's going on. So this is, I don't even think anyone's going to be interested in this video, because it's just pretty much me telling you about my doctor appointments. Oh, but I just didn't want people to get the Butrans patch mixed up with like the methadone, or I don't know. I knew somebody that got methadone, and they would have to go early in the morning, stand in line, and take a drink of something or a pill. They had to be seen doing it so that so they weren't selling it on the street. I guess, I don't know. People will do anything, you know. So yeah, I just wanted to make it clear that the Butrans patch does have the, okay, I'm gonna try to pronounce it, buprenorphine. Okay. The Suboxone also does, a methadone. It has that, but it also has another ingredient. I think it's naloxone. I don't know. Look it up. But someone once said, "Are you on methadone?" And I was like, I wasn't offended because people need it and need help, but I was like, no. You know, just because I'm on this patch, it has one active ingredient, and it's that long word, buprenorphine. Okay, and it is mixed in with another ingredient in methadone. So that's the difference. They have an added ingredient, and mine is just straight up Butrans, you know. So on that note, I'll let you guys go. I didn't have my notes in front of me. I'm in my basement. I didn't have my notes in front of me from upstairs. So I wrote notes and just decided to just do this video on a whim. So hopefully the next one will be a little bit more entertaining. Who knows? Okay, I'm trying to stay positive and don't make fun of my little friends here. They're just hanging out on the ladder, guys. You know, they want to be in the video. It doesn't matter where they're at. They're happy. Okay, guys. Happy holidays. I hope everybody had an excellent Thanksgiving. You know, got to spend it with family or friends. So I was with my kids, and it was great. Everybody have a great day, and I will talk to you guys soon.